There was a little bit of controversy the last time I discussed this topic, but I want to talk about it a little bit more. In pediatrics, children under the age of 18 do have some rights regarding their health care that they do not need parental consent for. And this includes things like pregnancy and reproduction, sexually transmitted diseases, contraception, treatment and advice regarding drugs and alcohol abuse, and sometimes some other things. Some of this is federal law and some of this is designated to the states. Controversy came when I had tons of people in my comments saying that if I was their children's provider and I gave them some birth control or something behind their back, they would not be happy about it. And let me clear some things up. I always open the conversations with my teens and my parents in the room. Everyone talks about what they want to talk about. It is so amazing to see teens that are so comfortable with their parents that they've either already had a conversation about what they want or they feel comfortable enough to talk about it in front of me and their parents. And then guess what? We're all on the same page and we all make a decision that's best for the child. But on the other hand, I do often try and make it a point to talk to my teenage patients by themselves. This gives them the opportunity to tell me anything that they feel like they have to tell me that they can't talk about in front of their parents. Whether that be their parents won't let them or whether that be they're just uncomfortable. At the end of the day, my job is to take care of the children. If they come to me and they say, I think I might have an STD, can you help me out? No, my mom doesn't know. I will test them and I will treat them without telling you because that is their right. If a young girl comes to me and tells me she's sexually active and she doesn't want to have kids and she wants to go on birth control, in my state, that is her right and I would respect that. I would encourage her to have a conversation with her parents regardless, but I would respect her decisions and I would order her birth control. If a patient comes to me and tells me that they might be pregnant and they don't want their parents to know about it, I would encourage them to have those conversations, but I would also direct them in where to go and what to do about it if they felt like they couldn't do that. So while my goal is always for everyone to be open and comfortable and confident talking in front of their parents, reality is that not all parents are like that. I'm starting this conversation because I want you to realize that it's better for you to be open and honest with your children about these conversations. That way they never feel the need to have to go behind your back. But just remember, regarding certain topics in certain states, they can.